always gets weighted a little heavier. So if you're going to skip something, consider not skipping the notes around the medical decision making. Go light on the physical exam if you don't need to. My classic example is someone who comes in who's depressed. They're an established patient, you know their history. Depression doesn't require typically a lot of physical exam. Maybe they're coming in, you're going to touch base on what's going on for them, how have they been doing, how's their depression, how is it manifesting these days, and then you're going to get into their medication management, the lifestyle, the self-hygiene, the self-care, etc. So your visit's going to be history or HPI and MDM, and the physical is going to be pretty light. And that's perfectly fine, and we'll look at the parameters around those things. The other thing to remember here is I'm going to shift our thinking a little bit, and I've always taught the SOAP note, S-O-A-N-P. That still exists. We're still doing that, but I'm going to shift our thinking into the guidelines, and the guidelines only talk about HPI, PE, and medical decision making. So HPI is your history of present illness, review of systems, and past family social history. It is your subjective, but these are the components that we need to hit on, and so those are the pieces we need to have kind of burned in our brains. Physical exam is physical exam. When we get to medical decision making or complexity, there's three components to that as well. How many diagnoses, and are they better, stable, worsening, or improved? How much data did you have to look at? And then the overarching risk. So again, there's three components to that. So we need to shift from just thinking assessment and plan to complexity and medical decision making, which encompasses assessment and plan. So just another thought to just kind of put into the mix here. But let's dive into the first component. History is history of present illness, review of systems, past family social history. With this piece of the three components for billing, you can only bill at the highest CPT code level that all three pieces meet the requirements. For example, for a 99213, you have to have 1 to 3 elements of the HPI, one piece of the review of systems, and you don't have to have anything in the past family social category. If you want to get that 99214, though, you can't skip anything. You have to get at least 4 elements on your HPI, between 2 and 9 systems on the review of systems, and you have to get at least one piece of the past family social. If you skip it entirely, you can only bill the 99213. Even if you got 6 pieces of HPI and all 9 of the ROS, if you didn't ask any questions about the past family social history, then technically you're only at a 99213. So that's why we need to understand these guidelines. Easy fix. Always ask their experience with this type of complaint, their past history. If you don't get to the family or their smoking and drinking habits for the social history, if you get their past history, now you've covered your bases. So that's what I mean by creating your flow and getting into the habit of these questions. And just because I didn't put it in a slide, because most of us are familiar with the 7 attributes, at least that's how we learned it at Bastyr, just so you know the elements of your history, history of present illness. What I'm talking about, your elements are location, quality, severity, duration, timing, context, status, and then your modifying factors or signs and symptoms. So we're going to look at the audit tool, and you're going to have that in another form to review, but that is what we're talking about with the 1 to 3 elements. So to get to a 99214, you need to make sure that you're getting